Talk about the ENT system and some anatomy and diagnostics within the eyes and the ears. All right, so 3 layers of the eye. You have your external layer, your middle layer, and your internal layer. So your external layer is going to have your cornea and your sclera. So the cornea is the transparent outer layer of the eye, and then the sclera is the white of the eye. You're going to have your middle layer, which contains the choroid, the ciliary body, and the iris. The iris is the colored portion of the eye. It contains the pupil, which controls the amount of light that reaches the retina. And then your internal layer is going to contain the retina. So the retina contains the fibers of the optic nerve. So this is your visual receptive layer of the eye, in which the light waves are converted into nerve impulses. This is also where there are photoreceptors known as rods or cones. So rods are responsible for peripheral vision, and then cones are responsible for colored vision or central vision. So the optic disc within the eye, so the optic nerve enters and exits the eye at the optic disc. The optic disc is also known as the blind spot because it contains only nerve fibers. It lacks those photoreceptor cells, and it's insensitive to light. The macula lutea contains the fovea centralis, which is the area of sharpest vision and where the most acute vision occurs. Its functions include central vision, night and color vision, and motion detection. The conjunctiva think of it as being located over the sclera when the eye is closed. So it's a thin, transparent mucous membrane of the eye that lines the posterior surface of each eyelid. So nerves. So there are 4 different cranial nerves that deal with sight and help with eye movement. So we talk about the cranial nerves in depth in our neurological section, but just know that cranial nerve 2 is the optic nerve. It deals with eyesight. 3 is ocular motor, 4 is trochlear, and 6 is abducens, all that help facilitate eye movement. So there are several different diagnostics for the eyes, and we're going to go over those individually. So for the fluorescein angiography, this is a detailed image of the ocular circulation. It's obtained through a series of photographs that's taken after the administration of dye. So it's used to assess problems with retinal circulation, such as those found in diabetic retinopathy, retinal bleeding, or macular degeneration. It can also be used to rule out the presence of intraocular tumors. So pre-procedure, the patient will receive a mydriatic medication, which causes pupil dilation. That medication is instilled into the eye about 1 hour prior to the test. Then a dye is injected into the patient's arm. It is very important to educate the patient that dye may cause the skin to be yellow for several hours. It's going to be excreted through the urine, so the urine may turn bright green or orange for up to 2 days after the procedure. All right, so a CT, it's used to examine the bony structures around the eye and the extraocular muscles, and contrast material may be used with the CT unless trauma is suspected. A slit lamp. So a slit lamp is used to examine the anterior ocular structures under microscopic magnification. So prior to the procedure, you want to advise the patient about the brightness of the light and the need to look forward at a point over the examiner's ear. All right, tonometry. Tonometry is used to assess intraocular pressure, and obviously it's used in the assessment of glaucoma because in glaucoma there's very close measurement of the intraocular pressure. There are 2 types. You have non-contact tonometry and then contact tonometry. Non-contact tonometry is where a puff of air is directed at the cornea. It is less accurate than contact tonometry. Contact tonometry, it does require topical anesthetic, but it's where a flattened cone is placed into contact with the cornea, and then the amount of pressure needed to flatten the cornea is measured. So very important to know, your normal intraocular pressure is 10 to 21. It does vary throughout the day, and it's usually higher in the mornings, but a normal IOP is 10 to 21. You want to educate the patient on the importance of avoiding rubbing the eye after the procedure. The anesthetic can put the patient at risk for scratching their cornea and them not knowing it. So avoid rubbing or touching the eyes after the procedure. All right, so the 6 cardinal positions of gaze, they can be used to assess for muscle weakness in the eyes. You're going to ask the patient to hold the head steady and then follow the movement of an object through the positions of the gaze. The ear. So moving on to the ear. Of course, the ear functions include hearing, maintenance of balance. You have the external ear, which is what you can physically see, the pinna. You have the middle ear, which has your 3 bony ossicles in it, the malleus, incus, and stapes. Your middle ear also conducts sound vibrations from the outer ear to the inner ear. And then your inner ear is where that sense of balance and equilibrium is maintained. It's also where that 8th cranial nerve takes place. So that 8th cranial nerve has a cochlear branch and a vestibular branch. The cochlear branch of the nerves transmits neural impulses from the cochlea to the brain, where they're interpreted as sound. And then the vestibular branch maintains balance and equilibrium. So different diagnostics for the ear, we have tomography, audiometry, ENT, and MRI. So tomography is used to assess the mastoid, middle ear, and inner ear structures. It's helpful in the diagnosis of acoustic tumors. Audiometry is a measure of hearing acuity. So you have a pure tone audiometry and then versus a speech audiometry. So pure tone is used to identify problems with hearing, speech, music, and other sounds, and then speech audiometry measures the ability to hear spoken words. And then you have ENG, or electronystagmography, or ENG. So pre-procedure, this patient does need to remain NPO for at least 3 hours prior to testing, no caffeine for 24 to 48 hours, and just educate the patient that it is a very long and tiring procedure. So it's a vestibular test that evaluates spontaneous and induced eye movements known as nystagmus. It's used to distinguish different types of nystagmus. The patient is instructed to sit and gaze at lights, focus on moving patterns and points, and then close the eyes. The ears are also irrigated with a cool, warm water, which may cause nausea and vomiting.